Hey guys, Curtis Alexander. I'm a pharmacist. In this video, let's talk about taking blood pressure medications because one of the things people often don't think about, and sometimes doctors don't think about, is that when you take blood pressure medications, because of what they're doing in your body, it can affect your nutrient status. So I want to talk about 5 of the more common classes, explain what can happen so that you and your doctor know what to look out for. So I'm going to start with the ACE inhibitors. This is a pretty popular class of blood pressure medications. And because of how they act in the body, what we can see is lower levels of sodium, lower levels of zinc, and also lower levels of iron. And interestingly enough, you can have a competing absorption between zinc and iron in your body. So to see lower levels of those together can really kind of screw things up. Now, I want to make it clear that I'm not saying you should supplement per se. It is something to maybe talk to your doctor about. But first of all, you'd have to measure these and then go from there if you choose to supplement. Not, I've mentioned in my other videos, supplementing with these isn't always the best thing either because we could throw things out of whack. Next, we have the angiotensin II blockers, and these kind of came about because the ACE inhibitors, the first group, can cause kind of a nagging cough, and the angiotensin II blockers are supposed to get away from that. Mainly what we can see with that is you can actually see potassium levels go up, so people can often be prescribed potassium tablets. So that can be problematic if you're taking an angiotensin II blocker. Another big one, diuretics, example of these would be like hydrochlorothiazide or Lasix, also goes by furosemide. Because diuretics increase your urine volume and you're peeing more, you can lose a lot of nutrients. Some of those are coenzyme Q10, very important. Also, we can see potassium go down. We can see decreased calcium levels, thiamine, magnesium. I guess I already mentioned potassium, sorry, zinc, and folate. So diuretics are a huge one for losing nutrients, losing minerals, those sorts of things. So definitely keep an eye on that. Next, we have calcium channel blockers. Um, we can see decreases in vitamin D, which is interesting. Also CoQ10 again, also potassium and calcium. So you're probably seeing some trends here with some of these big items, the CoQ10, the calcium, potassium, those sorts of things. And finally, we have beta blockers, um, also a big class that's used a lot, and not just for blood pressure. You can see beta blockers as well as calcium channel blockers used to help prevent migraines, those sorts of things. But with beta blockers, we can see low coenzyme Q10 levels. So hope that this video kind of sheds some light on, while blood pressure medications are popular, they're prescribed a lot, they can have downsides with the nutrient status. So one, try to get your blood levels measured so you know where you're at. And then if you are low or high based off what we talked about here, you can maybe supplement in certain cases after you talk to your doctor. So let me know in the comments, guys, was this helpful? Have you experienced any of these things with these classes of blood pressure medications? I'd love to hear it. And I know other people that watch the video would really enjoy reading your experience in the comments as well. So hope this was helpful. See you in the next one, guys. Thank you.